Hi, today we will be discussing about a very common high-risk condition of pregnancy, which is diabetes. Diabetes is a condition in which the blood sugar levels are elevated. This is a harmful condition both for the mother as well as the growing fetus. Poor control of diabetes during pregnancy increases the chance for birth defects and other problems for the baby. It can also cause serious complications for the woman. Proper health care before and during pregnancy can help prevent birth defects and other health problems. Diabetes is a condition in which the body cannot use the sugars and starches, the carbohydrates it takes in as food to make it into energy. The body either makes no insulin or too little insulin, or cannot use the insulin it makes to change those sugars and starches into energy. As a result, extra sugar builds up in the blood. Now, what is gestational diabetes? This is a type of diabetes that is first seen in a pregnant woman who did not have diabetes before she was pregnant. Often, the gestational diabetes can be controlled through eating a healthy diet and exercising regularly. Sometimes, a woman with gestational diabetes must also take medicines or insulin. We should also know how is diabetes during pregnancy diagnosed. Nearly all the non-diabetic pregnant women are screened for gestational diabetes as soon as they are pregnant and also between 24 and 28 weeks of their pregnancy. A glucose screening test is given during this time. For the test, you drink a glucose drink, 75 grams of glucose, and have the blood sugar levels tested after 2 hours. If this test shows a high blood glucose over 140 mg per deciliter, the gestational diabetes is diagnosed. Now the question is, how is diabetes during pregnancy treated? Treatment will depend on your symptoms, your age and your general health. It will also depend on how severe the condition is. Treatment focuses on keeping the blood glucose levels in the normal range and may include a careful diet with low amount of carbohydrates, fruits and drinks, exercise and blood glucose level monitoring. Insulin injections might be needed if the oral medicines for hypoglycemia, which are given first, do not work. Now coming to what are the possible complications of diabetes during pregnancy. Most complications happen in women who already have diabetes before they get pregnant. Possible complications include need for insulin injections more often, very low blood glucose levels, which can be life-threatening if untreated, might occur. Ketoacidosis might occur from very high levels of blood glucose, which also may be life-threatening if they are untreated. Women with gestational diabetes are more likely to develop type 2 diabetes in later life. They are also more likely to have gestational diabetes with another pregnancy. If you have gestational diabetes, you should get tested a few months after your baby is born and every 3 years after that. Possible complications for the baby include stillbirth, which is fetal death. Stillbirth is more likely in pregnant women with diabetes. The baby may grow slowly in the uterus due to poor circulation or other conditions such as high blood pressure or damaged small blood vessels. The exact reason stillbirth happens in diabetes is not known. The risk for stillbirth goes up when women have very poor blood glucose control with blood vascular changes. Birth defects might occur. They are more likely in babies of diabetic mothers. Some birth defects are serious enough to cause stillbirths. Birth defects usually occur in the first trimester of pregnancy if the patient has diabetes. Babies of diabetic mothers may have major birth defects in the heart and blood vessels, brain and spine, urinary system and kidneys and digestive systems. Macrosomia might be occurring. This is when the baby is much larger than normal. All of the nutrients the baby gets comes directly from the mother's blood. If the mother's blood has too much sugars, the pancreas of the baby make more insulin to use this glucose. This causes fat to form and the baby grows very large. This is macrosomia. Birth injury might occur. It may occur due to baby's large size and the difficulty when it is being born. Hypoglycemia might occur. The babies may have low blood glucose levels right after delivery. This problem occurs if the mother's blood sugar levels have been high for a very long time. This leads to a lot of insulin in the baby's blood. After delivery, the baby continues to have a high insulin level, but no longer the blood glucose is entering from the mother's blood. This causes the newborn's blood glucose levels to get very low. The baby's blood glucose levels is checked after birth. If the level is too low, the baby may need glucose in an IV drip also sometimes. Trouble breathing, that is respiratory distress, may occur. Too much of insulin or too much of glucose in the baby's system may keep the lungs from growing fully. This can cause breathing problems in the baby. This is more likely in babies born before 37 weeks of pregnancy. Preeclampsia might occur. Women with type 1 or type 2 diabetes are at increased risk for preeclampsia during pregnancy. To lower the risk, they should take around 150 mg of aspirin daily from the end of the first trimester until the baby is born. How is diabetes during pregnancy managed? Special testing and monitoring of the baby may be needed for pregnant diabetics, especially those who are taking insulin. This is because of the increased risk for stillbirth. These tests may include fetal movement counting. This means counting the number of movement, the number of kicks in a certain period of time and watching for a change in the activity of the baby. Ultrasound is done. This is an imaging test that uses sound waves and a computer to create images of the baby's blood vessel, the tissues and the organs. Ultrasound is used to view internal organs as they function and to look at the baby's blood flow through those blood vessels. Non-stress testing is done. This is a test that measures the baby's heart rate in response to the baby's movements. Biophysical profile is done. This combines the tests such as non-stress test and the ultrasound to check the baby's movements, heart rate and the amniotic fluid. So in short, we have discussed today about diabetes and its complications during pregnancy. Let us work together so that your diabetes does not harm you and your fetus and your pregnancy ends in a healthy and a happy mom and a healthy and a happy baby. Bye bye.